So a guy came into the office and he tells me that both of his arms feel like they are on fire. And I thought to myself, oh awesome, I know exactly what this is. This is a cervical disc herniation. I know how to fix those. And the truth of the matter is that yes, I did know how to fix those, but at the time I was only 2 months into practice. Completely on my own, no teacher to ask, no friends to call, no book to reference, just me as an idiot doctor fresh out of school. And the truth was, just like everybody who's experienced a disc herniation, I was terrified of working with them. That's why today I want to talk about signs and symptoms of a disc herniation, but more importantly, 3 steps that you can do today to kickstart your recovery and make sure that you're healing back to 100% without any of those lingering numbness symptoms or weakness. Or if you would like a free introductory guide on how you could start with rehabilitating a cervical disc bulge, check out the link I have down in the description. It is a full hands-on introduction on how you can do just that. So, let's get started. But most importantly, before we start talking about how to treat a cervical disc herniation, we should probably make sure that you actually have one. Because otherwise this gets really awkward when we're talking about one condition and you're trying to treat something completely different. So, cervical disc herniations are normally going to present with a history of trauma, but, big but, they are commonly experienced in middle-aged men atraumatically, meaning nothing cool has to happen. I've had a handful of cases since this one where people just woke up from naps with numbness in their arms, which is one of the common symptoms, numbness in the upper extremities. It can be part of the arm, part of the hand, it can just be a couple of fingers, it can be the entire arm. It really is going to come down to the exact location and severity of that disc damage. But additionally, beyond just numbness, you're also going to be looking at neck pain in case that weren't obvious. Normally, when things explode in your neck, they tend to hurt. Additionally, weakness in the arm. Again, this can be a couple of fingers or it might be the entire arm is weak. But all 3 of those are going to be really good signs that you did have at least a disc bulge happen in your cervical spine. Finally, but not always, if you are experiencing headache symptoms, cervical disc herniations can contribute to headaches. My patient had all of these symptoms. So while I was very proud of myself for properly diagnosing a cervical disc herniation, I still had a problem. I did not feel comfortable treating this yet. But just because I didn't feel comfortable treating the situation, the patient didn't feel comfortable, period, no matter what he did. So, at a certain point, you have to realize that you're just going to have to suck it up and do your best. So here's what we did. But why is that, Dr. Beck? Why wouldn't you feel comfortable where treatment involves dealing with a balloon in someone's neck that has now started to leak? Well, it's because discs are finicky, and depending on how aggressively you treat them, you do run the risk of making them worse. And 2 months into practice, that was not exactly the reputation builder I was looking for. So, the first and most common treatment for cervical disc herniations is what's called traction. And traction, as some of you may have also seen on YouTube, is whenever we place a Y-strap or a Y-axis strap over the back of the skull of a patient, and we pull long ways, producing a negative pressure inside the joint capsule, which sucks the nucleus pulposus, the squishy part on the inside of that joint, back into the annulus fibrosus, the rough outer part that holds your stuff together. And by gently, keyword, gently performing that traction, you can effectively pull that disc jello back into the center and get any of the chemical irritants off the nerve that are causing that numbness and weakness in the upper extremity. Fun fact, I did not have a cervical traction device, so we had to do the next best thing, which is manual traction, where you're doing it by hand. But the second thing that you would want to do immediately after having a cervical disc herniation is passive ranges of motion, where we're searching for positions that decrease numbness and other symptoms in the upper extremities. Unfortunately for my patient at the time, he didn't have a lot of positions that decreased his symptoms. So where do we go from here? Like I said, since I didn't have a traction device, we had to manually traction the patient's neck with my oven mitts. After doing that negative traction, what we then performed was passive range of motion, where I was taking them through ranges of motion that decreased their pain, 1, to help get any fluid out of the area, and 2, in hopes of creating that negative pressure that would also help suck that disc back into the annulus fibrosus. But finally, what we have to do isn't just mobilizing a joint, and it's not just sucking a disc back into the joint capsule. We need to stabilize that joint by getting those muscles that support it to fire and hold, which is what I'm going to show you now. And the main thing to remember with these movements is that we are injured, so the point is not to be finding how much we can hurt ourselves, but rather how gently we can move into a position that doesn't hurt and hold it. Now, if it wasn't just his disc causing his symptoms, then that meant we also had soft tissue problems, something coming from instability in the joint. But since his history didn't have any trauma in it, it meant most likely that we had overstretched or strained a muscle. The good news is, that's an easy fix. We need to do the third step, which is to stabilize that joint. The bad news is, when you're experiencing disc symptoms in both arms, doing exercises is probably the last thing you actually want to do. Now, to perform these exercises, you're going to want to be seated, because while this will increase pressure on the disc, it's going to alleviate some of the tension on the muscle fibers. Now, how we perform these exercises is in a form called isometric. Iso meaning equal, metric meaning distance. Equal distance meaning as we contract that muscle, nothing moves. And why we do the movement this way, or lack of movement, is because we're training that nerve to continue to fire a signal and then training that muscle to sustain a contraction. Because after an injury like a disc herniation, we need that joint to stay stable, otherwise we risk those muscles going back into spasm and putting uneven pressure on an already damaged disc. So, how we perform these is all motions start with a chin retraction, meaning that we pull the chin back, like we're trying to make a double chin. And we'll hold this position to start, because even this, elongating the spine by pulling the chin back, is going to help not only stabilize the joint, but also create a negative pressure in that joint space and help to pull that disc back into the annulus fibrosus. Once you get comfortable holding that position for 5 to 10 seconds for 3 to 6 repetitions, you can start incorporating tiny rotations where the chin remains pulled back and you will slightly turn your head to the left and hold. And then slightly turn your head to the right and hold. With that same frequency of 6 to 10 seconds, 3 to 6 repetitions, ideally getting your neck used to holding you in a position for about a minute. And then finally, once rotations become comfortable, pull that chin back and gently tilt your head to the left and hold. And to the right and hold for that same frequency. That way, no matter what position you put your head in, that neck is stable and that disc is protected. The reason that we do all this fun stuff comes down to anatomy. Because when we traction two vertebrae apart, what we're doing is creating that negative pressure which will help pull a bulging disc back into the center of the annulus fibrosus. But additionally, before you can start moving your own joints, you kind of need someone to take you through those ranges of motion passively, meaning a physician is moving you through those motions so that those damaged muscles don't need to pull and risk straining themselves. But then finally, if those muscles never get stronger and they're never able to sustain a contraction, you're never going to have stability in that joint space again. And why this is problematic is because when we suck a bulge back into a disc, eventually what'll happen is we have to load that joint again. And if there's still a hole in that disc, that bulge is just going to pop right back out. We need to minimize the compressive load of these two vertebral bodies on that disc so that this bulge can stay inside the disc and that crack where it would have seeped through can start to heal. Because so long as that bulge continues to happen, not only do we get a weakening and re-tearing in that disc, but we're constantly putting pressure on the nerve that exits out of that lateral foramen, which is the opening in your spine where your nerves exit from the central nervous system. And as long as that continues to happen, you're going to keep experiencing that weakness or numbness in your arm. But that would mean the second that we get that bulge back into the disc, the symptoms would just go away, wouldn't they? At the end of the visit, either genuinely or just because he felt bad for me, the patient stated that he was feeling better, a little better, which is a little bit of an ego hit for me because most of the time, even to this day, knowing the limitations, I like people to leave the office feeling at least 50% better than when they came in. But being 100% honest, I wasn't sure if I'd really helped the guy. After he'd spent about an hour at the office, I kind of wondered if I hadn't agitated his symptoms. Despite doing everything by the book that I had come to learn over the last 3 years in school. We scheduled a follow-up for 2 days later, and I held my breath, in part hoping that he would come back 100% healed, and the other part of me hoping that maybe he just wouldn't come back. 2 days later he came back, which is normally a positive sign, and what he said was that while his symptoms weren't completely gone, he did continue to feel significantly better as the days went by. Which raises a question. If we did successfully do the right steps and get that bulge back into the center of that disc, why wasn't he feeling so much better when he first left the office? And this comes down to another part of the anatomy of a cervical disc bulge. When a disc bulges or herniates, it puts pressure on a nerve as it exits your spinal cord. And that pressure is irritating to the nerve. So, even after we remove that pressure, the nerve is still aggravated. Think of it like when you floss your teeth. Once you finally get that popcorn kernel out from under your gums, it still hurts for a while as that inflammation and swelling recede. And it's not until that swelling and irritation fully diminish that you experience relief from, in this case, a cervical disc herniation, or in your case, an attack from the movie theater popcorn. I was able to keep working with that patient for a few more weeks, and after about a month, his symptoms had completely disappeared. I like to think that I've learned a lot in the 6 years since treating that patient. Specifically that, unfortunately, some injuries take time to heal. And I don't like to hear that any more than you do, but the body does have some physiological limits in terms of how quick it can heal. And since discs don't have a great blood supply, they can take anywhere from a couple of days to a couple of months to fully heal. That's why on this channel we have a bunch of videos coming out on cervical discs and what you can do to help yourself recover and get yourself on the right path to recovering fully. But additionally, if after a diagnosis of a cervical disc herniation, you want a full program to guide you through what a recovery would look like, from day one after a herniation all the way to fully recovered and not experiencing any numbness or weakness symptoms in your lower or upper extremities, check out the Cervical Disc Recovery Blueprint, because that is going to walk you through that entire process so that despite the diagnosis, you don't feel like you're going through it alone. Additionally, if you're in the Brackenridge area, by all means, call the office or schedule online. That link will be down in the description as well. I would love to work with you, because cervical discs are scary, and over the years I've gotten very comfortable with treatment of them. And rather than you going to an emergency room and just getting a prescription for muscle relaxers, you can come to the office and we can actually help to diagnose and fix this problem so that you don't have lingering results and you aren't dependent on painkillers to get you relief. And with that, I'm Dr. Beck. Thank you so much for watching. If you found this video useful, please leave it a like so that more people are able to find it and recover from their own cervical disc herniations. And if nothing else, I hope this video and this channel can help you to make the most of your one life.